Hello and welcome back to part four, to joints and overview. Okay. So this time we're going to talk about some of the movements of joints, just in a very general sense. Okay. Let's start over here with the concept of flexion and extension. So extension means that we're moving something back to, say, where's my pen? There it is. Back to midline, right? So we're moving back this direction. Flexion means if you were thinking of anything like a bicep curl, like when you flex your bicep, right? So you kind of make it more of an acute angle. That's that. And then hyperextension kind of just, oh, you can almost feel it pull a little bit out of where its happy place is. Here again is that same flexion, extension, right? So extension is moving back to that midline. Flexion is moving up and away from the body in this case. And this is at the shoulder joint, right? So this is different from the elbow joint. And then hyperextension is moving it back past that midline to that hyper or beyond comfortable point. This is kind of the more canonical one for flexion that I like to use. I probably should have started with it. So here's flexion as you were flexing, like say, classic, making the muscle, making the bicep in that acute angle, and extending it down back to midline. However, you'll notice the elbow joint doesn't, because of the hinge nature, doesn't extend into a hyperextended state. So there are just the two for a shoulder. However, the hand does allow for that. So here's extension back to midline, flexion coming up and making that nice acute angle right here. And then hyperextension, making an obtuse angle or kind of moving it back beyond comfortable point in position. All right, here are also examples there's my pen, for the hip joint, right? So midline, moving forward, up, and then backwards, a little less comfortable, a little less stable of motion. Hyperextension, same for the knee joint. However, we want to talk really quickly about this one here, okay? So this one we're talking mainly about the spine. And so in this case, we have only a lateral flexion, right? So we don't have really a hyperextension in the other position, right? So we have lateral extension or a lateral flexion and then extending back to midline exclusively. Okay. All right. And the next one. So these are some different motions that we're looking at the head and arms. They also work for the legs. Well, so let's see here. There it is. Okay. All right. So I think of abduction and adduction. So abduction, think of like, oh no, we were abducted by aliens, right? And when they did that, they pulled us up and away from the earth into their ship, right? Away from the body, away from the midline. And then adduction, you notice the word add is actually in it. So you're going to add the arm back to the body. Circumduction is making a circle, right? Just making a little like circle with your, say, hand, arm, your foot. It involves that full rotation, however. So different ones would be, or different motions with your hands would also be a lateral rotation and a medial rotation, so moving your palm. So upward and back, right? So palms would be facing up, would be our lateral rotation. Our medial rotation would bring it back to the body. And then let's talk also about the head. So we can't circumduct the head, right? We can't make a full circle. That would mean we can spin our head around looking somewhat like an owl. Not that they can do it either, really. But rotation just means we're going to move it from one side and then to the other side, right? So we're looking left, we're looking right, and then back again. So we never really are able to look behind the head altogether. So that's the rotation, which is opposed to circumduction. Okay. A couple of other positions I wanted to go over quickly was neutral position, right? So neutral position brings the hand directly up from the midline and almost like points directly towards the front of the body with the thumb superior upwards facing towards the head. Supination, right? So it's a supinate. Think of it to make like a bowl of soup, right? So if you were to put some soup in that hand, this would be the best chance you had of not spilling it, right? And then prone or pronate is referred to as kind of like the resting or the death pose. And so that would be you dump out your soup, right? It's the opposite of supination. Gliding is referring to these little carpals here in the wrist, and they are moving kind of side to side, like in the Queen's or the Beauty Queen's wave. Uh, so that would be it, just right there from the wrist. It's not from the shoulder, from the elbow, just a gentle wrist glide. Okay. The other ones I want to look at real quick are some of those that are with the feet. So if you put your toes down like a ballerina, it is plantar flexion, and the idea is you're moving down towards like the plantar surface. Think of you're pointing at the plantar surface with your toe, right? And then dorsiflexion like moves up, right? And you think of like say a dorsal fin being on a shark right here. That's kind of not too scary of a shark, I guess, but you'd be moving towards where the dorsal fin is, which would be like here at the top or the back point. Eversion means you evade the body, you evade the midline, right? And inversion means you roll it in towards or in towards the midline, right? So if you were to roll your ankle and it was an inversion, you had rolled your ankle towards the midline of the body. And if you had rolled your ankle and it was out away from the body, you evaded the body's midline or you everted the ankle. Okay. Finally, the last ones to talk about here would be those dealing with the thumb and the mandible. So when we pull our mandible backwards, right, and we give ourselves an overbite, it's known as retraction. When we give ourselves an underbite, right, so our lower teeth are on top of our upper teeth, our mandibular teeth are like kind of biting over the maxillary teeth. That is known as the protraction of the mandible. Elevation and depression, kind of think of chewing, right? So you elevate to take a bite to crunch down, and you depress to open up that mouth and provide space between the teeth again. And the last one is the opposable thumb. You've heard of humans having an opposable thumb, and that is simply a pinch, right? That is all between your pointer finger and your thumb, so they are now opposed. Okay, so I hope that was helpful. There's some of the basic movements of the joints, and all right, we hope you're out there somewhere having a great day. Good night.